Just 2 Delta cases last July 16th, the number of infected with the highly transmissible variant in Metro Manila climbed to 147 within 3 weeks, with the health department confirming the variant's presence in all 16 cities and 1 municipality in the capital region. This variant already infected 450 people, including 69 returning Filipinos and 352 individuals from 12 regions. The DOH already raised the pandemic response alert status in many areas with this variant. Each area is classified based on the number of cases, hospital and ICU bed use, and the presence of the Delta variant. 9 provinces are still under Alert Level 1, or at low risk. This means COVID-19 cases here are low and decreasing in the past 2 weeks. Less than half of dedicated hospital beds are in use, and there's still no Delta case reported. Meanwhile, 28 provinces and 4 cities have been placed under Alert Level 2. COVID cases here are low but increasing. Less than half of dedicated hospital beds are in use. Other areas have Delta cases reported. At this point, health facilities should have 30% of hospital and ICU beds for COVID-19 patients. 42 areas are on Alert Level 3. These provinces and cities have been recording high and increasing number of infections. 50 to 70% of dedicated COVID beds here are occupied. Granular lockdowns and active case finding should be done at this point.
They have to target decongesting their hospitals from mild and asymptomatic cases. They have to start increasing their hospital bed capacity to 30%, increase ICU beds for COVID-19 for levels 2 and level 3 hospital.
37 areas are under the highest alert level, where COVID-19 cases are high and increasing. And health facilities are almost full, with over 70% of beds for COVID-19 patients in use.
Implement granular lockdowns, to use rapid antigen tests when they have it as their resources for active case finding. There is also an urgent need to increase hospital beds, especially ICU beds for levels 2 and level 3 hospitals. They have to ensure oxygen needs available.
While the government has been adding spaces in hospitals and quarantine facilities, the country is still short of over 18,000 contact tracers. Currently, there's only 1 contact tracer for over 900 people, far from the ideal ratio of 1 contact tracer per 100 people. Caroline Bongkin, CNN Philippines.